My name is Alexandra Getchell from Rasmussen College School of Nursing, and this presentation is on gout, which is a pathological condition of the joints. Gout is a common form of arthritis. It's also referred to as gouty arthritis. It causes severe pain, redness, and tenderness in the joints of those affected. It's estimated that there are about 3 million cases of gout in adults at any given time in the United States, and it primarily affects men. Gout is caused by having high levels of uric acid in the blood. It's normal for our bodies to attain a certain level of uric acid through the breakdown of a chemical compound called purines. These are found in foods such as meat, poultry, and seafood. However, a normal function of our bodies is to also excrete excess uric acid through our kidneys. For some, this excretion process does not get rid of enough of the uric acid. As it builds up and levels get higher and higher, crystals begin to form in the joints which cause inflammation. Hippocrates referred to gout as the unwalkable disease. This is an accurate description because the joint that gout most often affects is the joint of the big toe. Symptoms occur very suddenly, and there are not typically warning signs leading up to a gout attack. The kidneys can be affected long term as these uric crystals continue to form in the urinary tract and can cause kidney stones. Unfortunately, the signs and symptoms of gout occur very suddenly and often without any warning. Also, interestingly, symptoms occur for the most part at night. Gout is truly a disease of the joints, and perhaps the most notable symptom of gout is intense pain. Pain is usually the worst within the first 4 to 12 hours after the original flare-up. Even after this pain subsides, joints can still be uncomfortable and stiff for the next few hours. Another sign of gout is inflammation and redness. Wherever the gout occurs, the joint will be very red and very swollen and tender to the touch. Lastly, gout attacks will result in limited range of motion. Right away after a flare-up, joints will be stiff, but over time they can become more and more difficult to move. Gout is a painful and unfortunate condition to have, but there are steps that can be taken to treat and prevent it as well. Those who experience gout should limit some of the foods that they eat. Certain foods contain that chemical compound called purines, which raise uric acid levels. Uric acid is the foundation of gout. Meats and seafood contain the highest levels of purines. Alcohol should also be avoided for those with gout. Beer especially. It has very high levels of purines and is one of the most notable ways of causing gout. 2 other ways of preventing gout attacks are regular exercise and weight management. Exercise is important of any health endeavor, but can especially be helpful in reducing risk of gout attacks. Finally, maintaining a healthy weight is very important when dealing with gout. A diet low in fat helps to control gout, but low-calorie diets can actually raise uric acid levels. There needs to be a balance. There are many issues that result from having gout, which can be either short or long-term. Short-term issues include extreme pain that people suffer leading up to and during a gout attack, as well as the pain that does not subside right away afterwards. Joint stiffness affects people short-term as well. Additionally, as mentioned before, joint stiffness can become a long-term effect by leading to loss of range of motion in the joint. Redness and swelling are also included in short-term effects of gout. Long-term effects can include arthritis and even kidney problems. The issues people experience with uric acid can destroy joints, and many people often develop kidney stones later in life as a result of this uric acid buildup in the kidneys.